Today's topic is about the tear trough injection and then the problem people have with under eye. The problem that people have under eye is probably one of the most broad and diverse problems. It's going to be a long list of the problems. It can be weight loss, it can be tiredness, it can be pigmentation, it can be fat herniation, it can be volume loss, it can be allergies, it can be all different kind of sorts of things. And obviously the traditional filler, which is hyaluronic acid, is not going to be one answer to everything. So the tear trough, what we recommend to come and see the physician provider, and then they will recommend what product you need and what procedure you need. One of the things that we do is traditional filler. If somebody has just a volume loss, they don't have much of a fat herniation, or even if they have a small fat herniation, but they don't have much of a pigmentation. So in those cases, we will go and fill that volume loss with the traditional filler with the hyaluronic acid. And again, the result is going to last for a long time. Sometimes what bothers people is not the volume loss, but it's more of a pigmentation in that area. So traditional filler won't go and then change the pigmentation. So either they're not a candidate because they don't have a volume loss, or if they have a volume loss, on top of the volume loss, they have pigmentation as well. So traditional filler is not going to be addressing them to the fullest. So what we recommend at that time is some kind of biostimulant again. So what I recommend for them is going to be PRP, PRF. And then the new version of them is going to be PRP or PRF Easy Gel. So letter E, letter Z gel. What it means is that we draw the blood and we harvest the PRP or PRF out. And then with the rest, we're going to make a gel. And then we mix it with the PRP and the PRF and then kind of bring it back and inject in that area. That's a good treatment for people who have a mixture of both volume loss and the pigmentation. So it will remove the pigmentation and it will replace the volume loss with something that is completely natural. It's their own blood. So there's minimal chance of having a problem except for the problems that can come with the needle. Obviously, with any needle work that we do, there's going to be some chance of a side effect. The thing that we need to know about the PRP, PRF, and Easy Gel is that you may need to do a couple of sessions to be able to get the good result. And then the last technology for the trouble under eye, especially with the pigmentation, is what we call the nanofat injection. So what it means that we harvest a little bit of a fat and basically process it, purify it, emulsify it. So there's not going to be any fat cells, so it's not going to be much of a volume. But that product that we harvest from that fat cells, it has lots of growth factors and lots of stem cells. And that's probably the most effective way of removing the pigmentation in that area. And if we inject the nanofat, mix it with the microfat, it'll address both the volume loss and the pigmentation at the same time.